am Mr.Gamers. I am going to talk about effects of aspirin for primary prevention in persons with diabetes mellitus. Definition: Diabetes patients are at high risk for heart disease. Aspirin can be an important part of their treatment. Aspirin is a platelet inhibitor. It partially blocks the action of platelets, which are the components of blood that cause blood to clot. This reduces the likelihood of a blood clot forming, and therefore also reduces the likelihood of a heart attack or stroke.
In people with pre-existing cardiovascular disease, aspirin use is associated with overall benefit. Patients with diabetes mellitus are at increased risk of cardiovascular events, but the benefits and risks of aspirin as primary prevention in patients with diabetes are unclear. In this multi-center randomized double-blind placebo-controlled trial, 15,480 adults with diabetes but no evidence of cardiovascular disease were randomized to receive 100 milligrams of aspirin or placebo daily. The primary efficacy outcome was the first serious vascular event, defined as a composite of non-fatal myocardial infarction, non-fatal stroke or TIA, and vascular death. The primary safety outcome was the first occurrence of any major bleeding. After a mean follow-up of 7.4 years, the primary efficacy outcome had occurred in significantly fewer patients in the aspirin group than in the placebo group. However, aspirin use was associated with significantly higher rates of major bleeding. The majority of bleeds were gastrointestinal and extracranial. The numbers of fatal bleeds and hemorrhagic strokes were similar between groups. The authors conclude that as primary prevention in people with diabetes, low-dose aspirin reduced the risk of serious vascular events, but it also increased the risk of bleeding. Full trial results are available at nejm.org.
Application in medicine. Aspirin prevents blood clots from forming in the arteries. It can help certain people reduce the risk of a heart attack or stroke, but taking aspirin is not suitable for everyone because it can cause serious bleeding.
It is particularly common in the head, body, and joints. Pain. But where does pain come from? And how do pain relievers work? In response to a trauma, a person only feels pain once the affected cells have reacted to it and have started transmitting pain messages like this. The cell membranes immediately release fatty acids, shown here as long red chains. The fatty acids enter an enzyme, cyclooxygenase, anchored in the cell membrane. This enzyme now functions as a kind of catalyst. The fatty acids arriving at the enzyme are transformed and come out again as pain messenger substances, shown here as a yellow cone. These messenger substances are an exact fit for pain receptors on the nerve endings. There they dock, and the stimulation thus caused is sent on as an electrical signal to the brain via the nerve fibers. The brain receives the information and evaluates it. Only then does the person feel pain. Ouch! The entire complex process takes place in a split second. Now we come to pain relievers. They interrupt the transfer of information. The active ingredient in aspirin, acetylsalicylic acid, affects an important interface in the process. Specifically, the point where the pain messenger substances are created, in the cyclooxygenase. The active ingredient simply blocks access to this enzyme. As a result, fatty acids can neither find their way into the catalyst, nor are they transformed into the pain messenger substance. Less and less pain messenger substance is transmitted. When fewer and fewer pain messenger substances dock, the nerve endings send correspondingly fewer impulses to the brain. The result: the pain abates. A simple principle with a great effect. The active ingredient in aspirin, acetylsalicylic acid, eases pain quickly and effectively, whether in the head, body, or joints. Bayer.
Pros and cons. Pros. Taking aspirin regularly reduces the risk of some types of skin cancer by up to 18%. It is excellent for relieving migraines and headaches. Applied topically, it can help eliminate diaphragm and dental discomfort. Giving aspirin after a heart attack increases the life expectancy of the person who suffers it. Cons. Aspirin is likened to gas of peptic ulcer and stomach disease. There is no medical evidence that discontinued use is preventive of heart disease. The FDA suggests not taking aspirin if you have no previously have hemorrhagic stroke.
Well, recent updates have led to confusion among healthcare providers and patients alike about the use of aspirin for preventing cardiovascular complications. Here to tell us more about this and understand what we need to know when it comes to the safety and effectiveness of aspirin is Dr. Nisa Goldberg. All right, Nisa, let's start with the basics for those who may not know why aspirin is used or how it's used and how it helps. How does it help heart conditions?
Aspirin reduces the risk for blood clots that cause heart attacks and the majority of strokes in our country. And one in three, and its most important use is for people who already have had a heart attack and stroke, because we know that 1 in 3 people will have a second heart attack and 1 in 4 people will have another stroke. Aspirin reduces that risk by a heart attack risk by 31% and stroke risk by 22%. And so it's very effective in people who already have existing heart disease. The new guidelines were very confusing because they didn't change anything about what we call secondary prevention, those people who have already had a heart attack and stroke. The new guidelines addressed people who were healthy and didn't have a first heart attack or stroke. And really what the new guidelines recommended is for people between the ages of 40 and 70 to have a discussion with their doctor if aspirin is right for them. Because we know that people who are healthy, some are at higher risk for heart attack and stroke than others.
So I think you hit on it there. That's the important part is people who've already had maybe a heart attack or stroke, the numbers show that this can help, and it's really the people that you don't want to have them taking this without talking to a doctor, correct?
That's right. If you haven't had a heart attack or stroke or your doctor hasn't prescribed it, just because your friend is taking it or you read something about aspirin, it's best to talk to your doctor before taking it on your own.
Some of those the side effects they talk about that they're concerned about is the bleeding, because it thins your blood, and then if you get a cut or something, it can cause extra bleeding, right?
Well, the risk of having serious bleeding, meaning that you need a blood transfusion, is less than 1%. Oftentimes my patients see that they have some bruising, and that's not serious. So what we really want people to do is, if you think you're having a side effect to aspirin or any of your medications, before you stop it, you should talk to your doctor.
Absolutely. That's the important part, folks. No matter what you're taking out there, talk to your doctors, consult with them, and give them the advice, because they're there to help you, right?
That's right. We're always here to help our patients. And with the new electronic health records, you may not have to give them a call. You could just send them a question. Doctor, should I continue taking my aspirin? Doctor, do I need an aspirin?
Great point. Appreciate you joining us, and we're going to share this on our website a little bit later so that people can catch it one more time. Just go to first.
Use of blood in Ecuador. In Ecuador, diabetes is affecting the population of residents with increased rates. According to the ENSANUD survey, the prevalence of diabetes in the population aged 10 to 39 is 1.7%. The proportion increased from 30 years of age to 50. This means that 1 in 10 Ecuadorians already has diabetes.
Hello, I'm Dr. Steve Edelman. Should you take aspirin if you have diabetes? Well, the national recommendations say if you're over 50, you should take a baby aspirin, 81 milligrams. You can get enteric-coated, get it at Costco, it's cheaper. And enteric-coated means that it's less likely to cause a stomach ulcer. They rarely do, but they can. Now, there are certain situations where you do not want to take aspirin. And obviously, no one watching me speak should start aspirin if you're not on it without speaking to your doctor. But in general, it's very protective because people with diabetes, their blood forms clots a little bit easier than people without diabetes. And when your blood clots, you can have a stroke or a heart attack. And aspirin's been shown to be tremendously beneficial, one of the most important preventative therapies you can do.
In conclusion, the use of aspirin prevents cerebrovascular events in people who have diabetes and no obvious cardiovascular disease. Likewise, the daily use of aspirin increases the risk of internal bleeding, and this risk increases with age.
Daily aspirin therapy can be a life-saving option, but it's not for everyone.
It's important you get the facts before considering that daily aspirin. UVA's Dr. Brandy Patterson explains in this week's Straight Talk MD.
Hi, and welcome to Straight Talk MD. I'm here today with Dr. Brandy Patterson, a cardiologist at UVA Heart and Vascular Center. Now, many older adults take an aspirin to decrease their risk for heart attack and stroke, but a recent study reveals that a daily aspirin therapy may not be recommended for everyone.
That's right, Casey. Just recently, the results of the Aspirin trial were released and showed that daily aspirin therapy may actually be more detrimental than beneficial in some healthy people. So just because your spouse or your friends are taking an aspirin doesn't mean that you should start as well. It's very important you talk to your doctor first.
Yeah, what are some of the current recommendations for daily aspirin therapy?
Well, daily aspirin therapy is really the most beneficial for those patients who have already had a cardiac event, such as a heart attack or a stroke. In these instances, aspirin therapy is known as secondary prevention and can help reduce your risk for a second occurrence. But if you are a healthy adult who has never had a heart event, aspirin therapy may increase your risk of gastrointestinal bleeding. Weighing the benefits versus the risk here, aspirin therapy may not be the best option.
Yeah. And I know a lot of us have heard, if you think you might be having a heart attack, you should chew an aspirin immediately. Is that true?
Again, it depends on the person. So your first move should always be to call 911 if you think you're having a stroke or a heart attack. The EMS provider will then walk you through your next steps. If you have no allergies or no risk factors for complications of aspirin therapy, then chewing an aspirin can definitely help prevent the formation of blood clots and limit the size of a heart attack or stroke.
Okay, so it sounds like the main takeaway from this is really just talk to your doctor.
Yeah, that really is the main point.
Yeah, see what's right for you and what's not.
Absolutely.
All right, well, thank you so much. Thank you for watching.
Thank you.
Thank you.